First of all, do you see the strike now in its third week ending anytime soon?
Not very soon, because both sides seems to be digging in. They are not negotiating. Instead, they are shouting at each other. So it is not likely to end very soon.
But the government is saying it has paid their salaries in arrears. It's promising to meet demands to hire trainee doctors as well, beginning Thursday, which is tomorrow. Why won't they return to work?
Well, they listen to the union. What the government has promised or says it has released is likely to cover those who are in the national category. Not every doctor. They are complaining that all doctors are not catered for in that. And the strike is about all the doctors. So they have that problem. To add to that is that the credibility of the government has been wanting. And because of that credibility gap, it has a problem. People accepting.
And how has this impacted, patients around the country, especially given, that most people can't afford to go for medical services at private hospitals?
Well, the country is devastated. The patients are suffering. Some have died for lack of attention. You can't go to any hospital. Most people don't have the money to go to private establishments. And so the suffering is widespread, and it appears as if there is not very much concern about the suffering of the people.
Professor Macharia, I'm thinking about accident victims here. We've seen a lot of accidents. Nearly every week, a lot of people are dying on Kenyan roads, and including school children, college students as well. And I'm thinking about how many people would be seeking emergency services in a situation like this. Where do they go to? Really, can't the doctors do something about this?
Well, they should, but they are not doing. Those who are lucky go to private hospitals or maybe mission hospitals and places like that, which are ready to accept, at least for them, for the emergency purposes. But the government hospitals are demobilized, demoralized, and nothing is happening there. So when accidents happen, people are lucky to go to some of the private hospitals, which are then obligated to receive them as a matter of emergency. And thereafter, you have a serious problem of what happens.
Professor, how are Kenyans reacting to this strike?
They are devastated, they're disillusioned. They see failure in policy, because that's what it is. There is failure in national policy on matters health. I think the country made a mistake in 2010 when they tried to divide health and say some of it is national and the other one is devolved. That was a mistake that needs to be looked at. And there is general feeling that something went wrong. And the policymakers are failing the country, because ultimately it is the policymakers who are in trouble for failing to look after the interest of the country, of the doctors and the health workers everywhere.